Hello everyone, this is Mrs. Correa. Welcome to week 9 lecture. So we are starting with pediatrics now. Topics included in this week are principles of growth and development, developmental theories by Erikson and Piaget, growth and development of children from birth to 19 years, maltreatment of children, substance abuse and Down syndrome. There are so many developmental theories like Sigmund Freud's, Erikson's theory, Kohlberg's theory, Jean Piaget's theory. But for the purpose of this class, we are going to focus on Erikson's psychosocial developmental theory and Piaget's cognitive developmental theory. So Erikson's psychosocial developmental theory, you all are familiar with this, all these ages and the task and the negative outcomes. You have learned in your psychology class, you have learned in your 105. This is a review of it. Please read it. And this is a good chart. I put it, easy way to understand, but you should know this very well. Cognitive theories talk about how an individual thinks and how thinking influences worldview. Jean Piaget's theory has 4 stages. First one is sensory motor stage, that is from birth to age 2, and here it explains the cognition is through the senses. And the second stage is pre-operational stages, that is age 2 to 7 years, and here the development of motor skills occurs, increased ability to use words but not capable of logical thinking. And the third stage is concrete operational, that is age 7 to 11 years. They have able to organize thoughts in a logical order, categorize and label objects, and solve concrete problems. They have logical thinking, but they are not able to make conclusions. Remember that. The next one is, the last one is formal operational, that is age 11 to 15 years, or throughout the adolescence most likely. They have abstract reasoning to handle difficult concepts, and they are able to analyze both sides of the issues. And here they have the logical thinking, and they are able to reason it, and they are able to come to a conclusion. That is formal operational. We are going to discuss growth and development of newborn and infants, toddler, early childhood, school-age child, and adolescents. So please make sure that you study the play, discipline, and anticipatory guidance from textbook. And the following slides describes only the highlights of growth and development, and this is prepared by me going through different books, because these milestones, if you look in 10 different books, they all vary. So I have gone through different books, and what I feel it is more important, what it is more consistent in most books, and also over this past 21 years how I was following and practicing and what I was basing on. So these highlights are very, very important for the purpose of the examination. You need to study well these highlights given in the following slides. And I have mentioned in other PowerPoint that read the tables from your textbook. You just read them, you may get extra knowledge, but your exam will be based on the slides which I say highlights of growth and development. So please pay attention to it. You should know this very well. So like I said, most of the questions for your exam will be coming from the slides on highlights of growth and development on this topic. So by 2 weeks, the baby will have visual preference for face. At 1 month, lifts head, tracks with eyes, coos, recognize patterns. 3 to 4 months, the baby will be able to hold head erect. That is, baby will have good head control. So a red flag here is, by 6 months, if the child is not able to hold head erect, that is a red flag. Please remember that. Then baby will be able to roll from abdomen to back by 3 to 4 months. What happens during 5 to 6 months? Imitates others. Here imitating others in the sense like if you smile, they may smile, and if you cough, they may imitate a cough. If you sneeze, they may imitate a sneeze. So things like that. Then the baby will sit with support, makes raspberry sounds, rolls from back to abdomen. Then by 6 months, the baby is able to sit up, raking grass. That means, like when the baby, you may see the baby sitting and like sweeping with their hands. Then babbles, transfer objects from hand to hand, and the weight of the child doubles. You want to know that. At 6 to 9 months, the infant will start finger feeds, begins to creep on hands and knees or crawls. Stranger anxiety develops. They play peekaboo. Then teething starts. 9 to 12 months, pulls to stand, walk with assistance, 3-finger grasp, mama, dada, but they are not intentional. You may hear like mama, ma, dada, and sometimes dad will say, oh, he calls me first. Or mom will say, oh, he calls me first. But they are not really intentional, but till 12 months. Then waves, bye-bye, patty cake, peekaboo, all that, they will do well during this time. Creeps and cruise on hands and knees, they do well this time. And object permanence develops. By 12 months, the infant's weight triples. The head and chest circumference equal by 1 year of age. Walks without support. 2-finger finger grasp develops. Mama dada becomes intentional at this time, imitates parents, and understands the word no. By around 12 to 17 months, they will be able to build towers with 2 cubes. 15 to 18 months, build towers with 3 cubes, begins to use spoon and fork. It is just beginning. They don't know how to really use them. They may not hold it properly, but they will start using it. Drink from a cup. They will scribble, dump things. By 18 months, baby will be able to build towers with 2 to 4 cubes and will be able to remove clothes. By 2 years of age, the child will be able to walk upstairs with 1 foot at a time. Remember that, 1 foot at a time. And 2-word phrases. Child will have 50 words vocabulary, follow 2-step commands such as go there, come here, sit on the chair, such things. Then build towers with 6 blocks, use I, me, etc. Throw ball overhand and kick a ball forward, points to body parts, puts on clothes. By 2.5 years, the child will be able to jump up, draw vertical lines. It is drawing vertical lines, okay? Then able to build towers with 6 to 8 cubes, points to 6 body parts and name 1 picture. Speech 50% understandable and no 2 actions. By 3 years of age, ride a tricycle, walk upstairs with alternating foot, balance on 1 foot for 1 second, walk backward, brush teeth, use 3 to 4 word sentence, knows 250 to 500 words, and 75% of the speech should be understandable. Tells parts of a story, button and unbutton and dress and undress, copy, circle and copy a cross, name 1 color, build towers with 6 to 8 cubes, and by 3 years of age they should have 20 teeth. They do parallel play. A red flag here is a failure to speak in 3-word sentences by 3 years of age is a red flag. By 4 years, hops and stand on one foot for 2 seconds, able to use scissors, draw cross, a square, and draw person with 3 body parts, for example, sticky figures. Play with kids, so here the play becomes more cooperative. Name 4 colors. Vocabulary is around 1500 words. Copy capital letters. Count 4 objects. Tell a story. Remember parts of a story. They do pretend play, like play mom and dad. Ask questions like why, who. Everything is like why, but why? So they want to know the reason. And know the first and last name by 4 years and use toilet alone. By 5 years, stand on one foot for 10 seconds or more. May be able to skip. They should be able to tie shoelace. Use fork and spoon well at this time. Know full name and address. Count up to 10. Know opposite words. Print letters or numbers. Copy triangle. Draw persons with 6 body parts. By 6 years, the child should be able to copy a diamond shape, ride bicycle without training wheels. They may not be able to do it perfect, but 6 to 7 years they will be able to do it. I see my neighbor's son who is in first grade is doing that. He's 6 years. This is another tip I will tell you. This helped me to learn to, like, when I study things. Then when I go outside in a social gathering or in a worshiping place, I, start observing the children and the babies and the infants, toddlers, and their behavior, their activities. So this is how another way of, reviewing and reinforcing. You can talk to the moms, your friends' kids or your, relatives' kids, oh, the baby is, how many teeth the baby has, is the baby saying words like baba, dada, all that, how many colors they know, like you can ask some questions and they will be very excited to answer to your questions too. And this is a good way of learning too. And by 6 years, they will have increase in strength, follow directions, take turns, know numbers and colors, relate personal experience, know left and right name, and handedness is well established. By then you will know he's right-handed or he is left-handed. You will know that. School age from 6 to 12 years, child will be able to climb, bike, jump ropes, skips, learn to do organized sports or games like baseball, soccer, swimming, puzzles, crosswords, dance, etc. Wants to know how things work, sew, draw, make arts and crafts, build models, play video games, understands actions and consequences, logical thinking, but they are not able to come to a conclusion. Visual acuity is 20 by 20. Color discrimination fully developed at this time. Vocabulary is around 8,000 to 15,000 words. Increases peer group involvement, and their friends will be mostly same sex, like boys will have boyfriends and the girls will have only girls most of the time. And they master skills. The play is cooperative play. Adolescents 12 to 19 years, they develop secondary sex characteristics, increases speed, accuracy and coordination, manipulates complicated objects, high skilled level playing video games and using computers, precise eye-hand coordination, abstract thought well established, uses logic to solve problems, and they are able to come to a conclusion too. Follow complicated instructions. Peer group is the primary social environment for them. begins to explore romantic relationship, cooperative play, team sports, school or community activities, and dating. So these slides, which I mentioned as highlights of growth and development, this may look, I made it very simple and concise as I could for your best understanding, and I hope this helps for you. And this may seem very easy, but it is not easy to remember. I know myself, it requires a lot of review, like review as many times as you can. Please do that because this is not easy to remember. Next is maltreatment of children. Child maltreatment is abuse or neglect of child less than 18 years of age by anyone in a caregiver or custodial role. Child physical abuse is injury inflicted by beating, pushing, kicking, pinching, burning, or choking. Child sexual abuse is any sexual related act, usually between a child and an adult. Related or not related, they can be related to a child or a stranger. Child emotional abuse, any behavior, attitude, or failure to act that disrupts the child's socio-emotional development and mental health. Child neglect. This involves failure to provide emotional and physical care as well as opportunity for education. Next is Munchausen by proxy syndrome. Some people say Munchausen by proxy syndrome. It is a person, usually the mother, deliberately makes the child sick. I remember one case of this Munchausen by proxy syndrome years ago when I was doing my BSN program. We had a patient. So what this mother was doing, she was giving laxatives to this child. So the child will have diarrhea, like chronic diarrhea, like almost like once in every 2 months or once a month. This child is admitted to the hospital because of diarrhea. So, but this mom was deliberately giving laxative and making the child sick. Next is electronic sexual luring, and this is enticing children via internet. Signs and symptoms I want you to read from your textbook. Diagnosis is made by family history, physical examination, and developmental assessment. X-rays if you suspect any child abuse and like fractures. Serum chemistry lab test to determine any infection and drug induction or toxicity. Nursing care includes utilize primary and secondary preventive strategies, report abuse, education discharge instructions, which include provide parents with information regarding normal stages of growth and development. So as nurses, we should know the normal stages of growth and development. Then only we can identify abnormalities and red flags. Family education about what to expect from parenthood. Instruct parents on how to cope with difficult times related to raising a child. Help parents to seek resources for support such as babysitters, family members, and community resources. Substance use and abuse. I want you to read the signs and symptoms related to physical, emotional, and family from your textbook. The diagnosis is based on the physical, emotional, and social factors exhibited by the child, a thorough family history, and two tools which usually use is craft tool and cage tool, and I have explained this in the other PowerPoint, and it is also available in the textbook. Nursing care involves screening tools to assess drug and alcohol use, like I said, craft tool and cage tool. Using these are symbol acronyms to assist in the evaluation of drinking and drug abuse. Education and discharge instructions should include be allowed to identify early signs of substance abuse and observe for changes in mood or odd behavior. Help the family find community resources. Down syndrome, otherwise known as trisomy 21, that is There are 3 chromosomes on the chromosome number 21. The signs and symptoms involves poor muscle tone, slanting eyes with epicandial folds, hyperflexibility, short, broad hands with single crease across the palms of one or both hands. That single crease across the palms of one or both hands is called as simian crease. Flat bridge of the nose, slow, low set ears, short neck with extra folds of skin. The diagnosis is by chromosomal blood test shortly after birth. Nursing care includes be sensitive to the needs of the parents, help parents to cope with the baby's condition, provide resources, promote early intervention. Education and discharge instructions include educate parents and families about the resources. That is all about week 9 lecture, and please review it as many as times you can. I have reinforced that importance of reviewing, and I hope you enjoyed it. Thank you for listening.